Hello, I'm Dr. John Koehler. I started my first clinic 31 years ago in 1987. At that time, we didn't have occupational medicine in our practice. It was strictly urgent care. Shortly thereafter, though, a friend of mine shared with me about the benefits of occupational medicine, so we started doing that. Not long after that, I became board certified in occupational medicine and have been ever since. Occupational medicine has made a huge difference in our practice because it increases the patient volumes, smooths out the seasonality with flu season, and it helps the overall success of the practice. We've been doing that now for 31 years and have over 40 clinics, physicians immediate care in Illinois and Indiana. But what I've learned over these years, I had to learn myself. I had to learn all about OSHA recordables, lost time, setting work restrictions, calling companies and communicating with them, things that matter to them most, etc. This is not trained in any kind of residency or medical school, and so it was self-taught. And any occupational medicine veteran that you might know of would say to you that it's self-taught how to do a lot of the things that matter most to companies, at the same time practicing very high-quality medical care. So because this is a challenge, because times have changed now where the growth of urgent care centers is dramatic. They're everywhere. The acceptance of urgent care is now ubiquitous in our society. When I first started out, people didn't even know what the term urgent care meant at all 31 years ago. But now everyone knows about it. But many clinics and groups now are realizing they want to add occupational medicine to their practice. This is not easy because it's a different way of thinking about not taking a patient off work unnecessarily, things about, when do I recheck them back, what kind of restrictions do I give for certain, shoulder injury, ankle injury, back injury, etc. So what I've done is to really help medical providers is create a website called OccDocOne.com, and within that I have a QuickCheck tool that you can go to and you can look up any diagnosis you want. You can use a chief complaint, back pain, knee strain, shoulder pain, whatever it might be. It will take you to guidelines that I've created. These are easy to use, easy to access guidelines. You simply click on it, up comes the guidelines. It's in guideline form, so you can go down key history, key physical, studies, injury validation, diagnosis, visit 1 treatment, visit 2, visit 3, and then attached to that or within those guidelines are videos that you can simply click on the link. Up comes the video, 2 minutes, 3 minutes video that I talk about an issue that might be important for that stage of the treatment of the patient, such as why is continuity care important, such as setting work restrictions for this particular diagnosis, such as what x-ray to do, such as make sure you call the company, or OSHA recordable considerations for this case. So it's a tool for you. It's a tool that can help you and be readily available without having to make a phone call to somebody else to talk about it or a specialist. You can have access to these guidelines, which come out of my experience from 31 years of treating so many patients, that it can help you sort of like jump to a higher level in your proficiency and effectiveness in the practice of occupational medicine. So I hope you'll consider using it for your work comp injuries. Thanks.